Now, as the country joins the rest of the world in marking the World Mental Health Day, the push to have mental health among children prioritized is now backed by statistics. The latest figures indicate an upward trend in the number of children suffering mental health issues, you may say. Lois Wangui spoke to a psychotherapist on the matter.
So whenever the topic mental health is discussed, what comes to mind is basically adults or even young adults. But experts in this field advise that matters of mental health should be addressed as early as childhood, and hence our concentration tonight on the mental well-being of our children.
We are worried about tomorrow.
Amongst children, it's developing because, again, the need for parents to both be working, so there is no one-on-one with their children. And so children need to be, as they're growing up, they need to be heard, they need to be guided, they need to be nurtured. You're not just giving them food and paying for their school fees and saying, I'm raising my children. They need to be nurtured, to be molded, to be guided. And we see a lack of that, especially now in modern day parenting. We have delegated parenting again to institutions like schools, like church. If they're not in school, they're in Sunday school, and you're saying you're a good parent, but there is no one-on-one. Our children's needs are not being met as they should by their parents. I think of it this way: a parent who's always at work, on Friday hanging out with the boys and the girls, on Saturday work till midday, and then on Sunday we are going to the playground. Have you had time to know your children? Know your children's temperaments? Know your children's personality? This is my child's temperament. And so based on that, based on their behavior over a long period of time, you will definitely know when your child's mental health is declining. Behavioral changes will present as failing in school if they were a good student. Isolating themselves is not a sign that they are giving you space. If it's not an introverted child and they start isolating themselves, that's a sign to look out for. If they're overly moody, overly cranky, if they're having sleep issues, if they have regressive behaviors like bedwetting for a child who had stopped bedwetting, if they complain a lot. We tend to dismiss children when they're complaining. So if they complain a lot and you're just like, it's just bullying, it's school, all these could be indicators that their mental health is declining.
In psychology, we say,
because from a very young age, the way we treat our girls as delicate and careful, we forget that the same applies to the boy child as well. But because when the boy child comes, they are indoctrinated to be strong, to not complain, to not cry, to handle it as a man. They grow up with that attitude. You can never replace quality time with your children with anything. Because once you're a present parent, and this is not to guilt trip parents into not working and things like that, the little time you have with your children, if it's 1 hour, if it's 2 hours a day, make sure your gadgets are away, spend time with your kids. If a parent is present with their children, they're able to instill and transfer their values that they have to their own children. So it's not really about mother, father, or single mother or grandmother. It's about the needs of the children being met.
So the conversation on the mental well-being of our children is not as brief as what I have presented tonight. We were able to gather much more after this broadcast. Please be sure to visit with our website for the longer version of this interview. For now, back to you in Nairobi.